Welcome to my study on nature and characteristics of after pain among postnatal mothers. I'm Smitha Namboothiri. I work at the Interventional Radiology Department at Great Ormond Street Hospital for Children NHS Foundation Trust, London. Great Ormond Street Hospital is one of the top 5 children's hospitals in the world. It was formed in 1852 and is the UK's only paediatric National Institute for Health Research and Biomedical Research Centre. And now let me explain the relevance of this study. Postnatal mothers experience various physical discomforts after childbirth. An MRI study of the brain among postnatal mothers 48 hours after childbirth has shown that women have lower reactivity in insular, middle frontal gyrus, and inferior frontal gyrus, which increases susceptibility of pain among the postnatal mothers. So, however small the intensity of pain is, the mothers would perceive them as intolerable. And after pain, if prolonged, can lead to neurohormonal stress response, which further follows a cascade of anxiety, insomnia, and fatigue. And this can impede the breastfeeding process, which further leads to impairment in the attachment of mother to child. And also, if the pain continues further, this can be a cause of depression in the postpartum period. So this necessitates researches into after pain, and my study focuses especially on the nature and characteristics of after pain among postnatal mothers. And now let us see exactly what is after pain. After pains are crampy pains in the lower abdomen experienced by mothers commonly in the first 4 days postpartum. It is positive in nature as compared to the other forms of pain the mothers would experience after delivery, as the pain is due to the contractile efforts of the uterus to return to the pre-pregnant stage. This process is otherwise known as uterine involution. And about the after pain background, 50% of pemiparvus mothers and 86% of multiparvus mothers experience after pain. In the first-time mothers, uterine tone is good, the fundus remains firm, and the mother doesn't perceive much uterine cramping. Periodic relaxation and vigorous contraction are common in subsequent pregnancies and also in pregnancies where the uterus is distended, as like in polyhydramnios, multifetal gestation, and large baby, which accelerate after pains. And therefore, multi-mothers are expected to perceive more after pain and also in pregnancies where the uterus is distended. Evidences suggest increase in after pain with breastfeeding. Following childbirth, due to the action of oxytocin released from the posterior pituitary, the smooth muscles of the areola are contracted to establish breastfeeding. And at the same time, oxytocin induces contraction of the uterine muscles, which leads to crampy pains during breastfeeding. So the statement of the problem of the study: a study to assess the nature and characteristics of after pain among postnatal mothers at a tertiary care hospital in Cochin, South India. And in this study, nature refers to the intensity of after pain based on the pain scores on the numerical pain scale, and these were categorized as mild with a score from 1 to 3, and moderate with a score between 3 and 7, and severe pain with a score greater than 7. And characteristics refers to qualitative expression of mother's own pain, as well as any aggravating factors of pain, and as to what time the pain was present, if that's all the time, when moving, or intermittently. To speak about the methodology of the study, mothers after vaginal delivery and C-section were made to form into a quota until the required sample size of 50 was achieved. The sample size was estimated statistically from previous studies. The tool which was used for the study consisted of an interview schedule to collect the demographic data from the mothers and a self-developed PPQ, or a postpartum pain questionnaire, which the mothers were meant to fill based on how they felt the pain and as to what time they felt the pain. So the data collection process was a bit challenging, as the first observation was 12 to 24 hours post-delivery, and thereafter, exactly after 24 hours, the observations were to be repeated. And the timing of the first observation was different for each mother, and this was to be continued every 24 hours for 3 days after delivery. And the analysis consisted of the descriptive and inferential statistics, with the descriptive consisting of frequency, percentage, and mean, and inferential statistics using the chi-square test to find the association of after pain with the variables age, mode of delivery, and poverty. The mean scores of after pain between mothers who had vaginal delivery and C-section was compared by using Mann-Whitney U-test, as the deviation was greater than the mean, and the t-test couldn't be used. So just to explain the sample characteristics of the mothers, with regard to the age, most of the mothers were in the age group of 18 to 25, and almost equal number of mothers belonged to the age groups of 26 to 30 and 31 to 35. 10 mothers were aged above 35 years. And with regard to education, 40% of mothers were undergraduates and 30 mothers had primary education. More than 10 mothers had secondary education as well as master's degree. And when we see the baby weight, most of the babies born to mothers in this study had a weight in between 2.5 and 3.5 kilograms. And nearly half of the mothers were primiparous, and a few of them were grand multi-mothers. And nearly half of the mothers were active during pregnancy, and less than 10% of the mothers were on complete bed rest. And having a look at the mean score of after pain, we can see that on postpartum days 1 and 2, did most mothers experience after pain with greater scores always after vaginal delivery than C-section. And the mean scores are less than 3, probably because of the mother's greater concern for other kinds of pain after delivery. And the pain was never above 1, the mean score, on the day 3 postpartum. On the whole, the mothers expressed the after pain mostly as mild and moderate. 13, 19, and 10 mothers had mild intensity of after pain on first, second, and third postpartum days respectively, and 24 mothers on day 1, 21 mothers on day 2, and 7 mothers on day 3 had moderate intensity of after pain, and less than 5 mothers had severe pain on all the 3 days postpartum. And this slide shows the frequency of perception of after pain by the mothers. Most of the mothers felt the pain intermittently, which means that they couldn't express a particular time of the day when the pain was highest in intensity. 27 mothers agreed with it on day 1, and 26 mothers expressed the same on day 2. The number of mothers perceiving intermittent pain reduced to 13 on day 3. Also, 14 mothers on day 1 and 2 felt the pain when moving or changing positions, which further reduced to as 5 on day 3. Just one mother verbalized that she was having pain all the time. And it was interesting to note the description of after pain by the mothers. 32 mothers on day 1 and day 2 agreed that the pain is similar to menstrual cramps. 14 mothers on day 3 expressed the same as well. And other expressions of the pain were like stone moving inside, and that was by 2 mothers on day 1 and by 4 mothers on day 2. Two mothers on days 1 and 2 agreed that the pain is like the pain at the beginning of labor, and two mothers on day 2 and 3 emphasized that the pain they experienced felt like the entire abdomen being rolled, and that was a kind of weird expression of the pain. And other descriptions were like fetal kicks and like aching above the umbilicus. So the comparison of the mean scores of after pain between mothers who underwent C-section and vaginal delivery. So from the scores, it is clear that the scores on the day 1 between the mothers who had normal delivery and C-section were significant, as the p-value is less than 0.05, and the other days it was not significant at all. And the association of after pain with poverty using the chi-square test. So the after pain was significant with poverty on day 1 and day 3 with a p-value of 0.047 and 0.027 respectively, and it was not significant on the second day postpartum. With regard to the association of after pain with age of the mother, it was found that the age was not significant, and association of after pain with mode of delivery, again, the mode of delivery was not significant with after pain. And to discuss the study with the established facts, after pain increases with parity as the distension of the uterus will be more, and in this study, parity is associated with after pain on the days 1 and 2. And breastfeeding increases after pain due to the release of oxytocin and its effect on the uterus. However, in this study, mothers couldn't express a particular activity that increases after pain. Rather, most of them felt the pain intermittently. And movements are shown to distribute the effect of pain equally around the uterus, thus minimizing the intensity of pain being felt. And in contrast to this, movements had been the main cause of after pain for the mothers. To conclude, afterbirth pains called after pains vary from mother to mother. And especially, this difference is found between multi-mothers and primiparous mothers. And even multi-mothers cannot recognize and realize after pain. The pain intensities are easily forgettable, and the mothers couldn't express what kind of pain they perceived before in their previous deliveries. And some mothers don't even know what exactly is after pain. Even though the mothers were approached and talked about after pain, they were not sure pain they felt is exactly after pain or not. And as the mean scores are lesser, these are not often considered along with other pains. Therefore, further studies are required to validate the effects of after pain on large population. Thank you for listening.